Good day, everyone. In this MMT series, today we will be learning the manual muscle testing of the muscle serratus anterior. So, origin of this muscle, it is outer surfaces and superior borders of upper 8 ribs. Its insertion is on the costal or anterior surface, medial border of the scapula. The main action of this muscle, with the origin fixed, it abducts and rotates the inferior angle of scapula laterally, whereas the glenoid cavity cranially, and it holds the medial border of the scapula firmly against the rib cage. So if we start from a position with humerus which is fixed in flexion and the hands against the wall, so this muscle acts to displace the thorax posteriorly as the effort is made to push the body away from the wall. So same action happens in a properly executed push up, and it also helps in the forced inspiration. So main action is that it abducts the scapula and rotates the inferior angle laterally, whereas the moving glenoid cavity cranially. The nerve supply of this muscle is long thoracic nerve with the root value of C5, C6, 7, 8. Now before starting with the manual muscle testing, there is a preliminary examination. We have to observe the both scapulae at rest and during the active and passive shoulder flexion. Then patient is in the sitting position with the hands on the lap. We have to palpate the vertebral border of both scapulae with the thumb. Place the web of the thumb below the inferior angle where the fingers extend around the axillary border. So in the normal position, the inferior angle is tucked in and the normal scapula, it lies close to the rib cage with the vertebral border nearly parallel to from 1 to 3 inches lateral to the spinous process of the vertebrae. So the most abnormal posture of scapula could be winging, in which the vertebral border of the scapula, it tilts away from the rib cage, and this sign, the winging of scapula, it is a sign that indicates the weakness of the serratus anterior. Now for manual muscle testing, the position of patient will be high sitting, the hands will be on the lap. Position of the therapist will be the therapist will be standing on the test side of the patient. Now the resistance part. For grade 4-5, the resistance part, the therapist will use the web space of one hand along with the thumb and index finger to palpate the edges of the scapula at the inferior angle, and the hand which is giving resistance will be placed on the upper arm just above the elbow. Now what we have to test is that the patient, it will be raising the arm to overhead position with elbow extended, and what instructions we have to give is that we have to ask the patient to raise the arm forward over your head by keeping your elbow straight. Don't let me push your arm down. Now in grading part, to assess grade 5. So this grade 5 is awarded if the scapula, it maintain its abducted and rotated position against the maximum resistance. For grade 4, if the grade is awarded if the patient can tolerate the submaximal resistance. So if he could maintain this position against maximum resistance, that is grade 5. If submaximum resistance, then grade 4. Now in grade 3, this grade will be awarded if the scapula moves through the full range of the motion without winging, but they cannot tolerate any amount of the manual resistance given by the physical therapist. So the patient can tolerate the weight of his or her arm. So we will be giving grade 3 to the patient. Now for grade 2, the grade in this, the scapula abducts and rotates upwards as the patient attempts to hold the elevated position of the arm. So while we are testing grade 2, the position of therapist will be changed, like the hand that was giving resistance will be grasping the forearm just above the wrist and will be supporting the patient's arm to assess grade 2. In grade 1, there will be palpable contraction of serratus anterior, and if there is a palpable contraction, we will be giving grade 1 to the patient. And the site of palpation will be the tips of the fingers, they are placed just in front of the inferior angle of scapula along the axillary border of the scapula. And grade 0 is then there is no contraction activity in the serratus anterior muscle. Then we give grade 2. For better understanding of grades of MMT, we have another video in the channel, and I'll be putting the link in the description box. Thank you.